Hi everybody. From the chapter 1, we saw the importance of communicating effectively and sensitively with patients, and that these skills can be learned in this chapter. We are going to study how to get along with patients. Now we have to know the 4 basic principles of medical ethics. The first one is respect for patient autonomy. This means in medicine, autonomy refers to right of the patient to retain control over his or her body. A healthcare professional can suggest or advise, but any actions that attempt to persuade or coerce the patient into making a choice are violations of this principle. In the end, the patient must be allowed to make his or her own decisions, whether or not the medical provider believes these choices are in that patient's best interest, independently and according to his or her personal values and beliefs. Second is about benefits. Promote overall benefit. The means is that this principle states that healthcare providers must do all they can do to benefit the patient in each situation. All procedures and treatments recommended must be with the intention to do the most good for the patient. To ensure beneficence, medical practitioners. To ensure beneficence, medical practitioners must develop and maintain a high level of skill and knowledge. Make sure that they are trained in the most current and best medical practices and must consider their patients' individual circumstances. What is good for one patient will not necessarily benefit another. The third, this means non-maleficence. This means avoid causing harm. Non-maleficence is probably the best known of the 4 principles. In short, it means to do no harm. This principle is intended to be the end goal for all of a practitioner's decisions and means that medical providers must consider whether other people or society could be harmed by the decision made, even it is made for the benefit of an individual patient. Fourth is justice. The principle of justice states that there should be an element of fairness in all medical decisions. Fairness in decisions that burden and benefit, as well as equal distribution of scarce resources and new treatments, and for medical practitioners to uphold applicable laws and legislation when making choices. Who can tell me what patterns of behavior towards patient is unhelpful? Okay, now, as we know, we have to remember the 3 points. First one is to cure sometimes. This is the operation. Second you have to relieve often, get their trust. Third is to calm always, and this means we have to read the history of patients. This means that some diseases are completely curable. For example, infectious diseases and early stages of certain diseases can be completely cured under modern medical conditions. Unfortunately, however, the proportion of such diseases is not too high, and it would be nice to reach around 20%. Most diseases are caused by unclear etiology and unclear pathogenesis. The only thing the paramedics can do is relieve the pain, block the process, and prevent serious complications. For some serious diseases, such as advanced cancer, all we do is relieve the pain and mental comfort, no matter how advanced medical technology is. No matter how advanced medical knowledge is, no matter how strong the patient's economic strength, the disease will still worsen and the patient will still die. But medicine cannot cure every disease, nor can it cure every patient. The idea is that we doctors need to understand that patients need to understand that neither doctor nor patient can have unrealistic illusions about medicine. What is more important is to explain the duties of the doctor. We are not only to cure diseases, but also to help and comfort the patient. As we know, our medical personnel need to make unswerving efforts in humanistic care, as the famous Taiwanese write Long Yin Tai to medical school students of the trust. The sooner or later I will fall into your hands. I hope that I will face you that day, not only a skilled doctor, but also full of humanistic care of the spirit of comfort. For example, one patient was hospitalized for stomach ulcers. The doctor prescribed an imported drug, but he did not inform the patient of the name of the drug, in the intention of the drug, and whether or not to reimburse of the patient. After taking the drug for a period of time, the patient understood the name and nature of the drug from the nurse and learned that such drugs is out of the scope of medical reimbursement. At that time, he did not make any different opinions. He continued to take drugs and remained silent. When he was discharged from the hospital, he would check out the patient, proposed to check the cost of hospitalization. The cost of such imported drugs do not recognize. And he said, "Who asked you to prescribe imported drugs for me? I never take imported drugs." Therefore, we should explain the situation to the patient in advance and ask the patient's opinion when we treat the patient. Medicine has 3 important attributes. Scientific medicine, the technical medicine, and human medicine. If the doctor lacks sympathy, compassion, and care for the patient, then advanced technology will also depreciate. In fact, in the application of high technology in medicine, lack of humanistic care is precisely one of the important reasons for the crisis of the current tense, the doctor-patient relationship and the doctor-patient trust. Therefore, medical personnel not only treat patients with advanced technology, we must also strive to improve human literacy, to integrate as much human care as possible into the application of technology. Finally, thank you for watching. This chapter is over.